My name is Emily Novicki. I am a health scientist in the NIOSH Office of Policy Planning and Evaluation, and I was kind of the lead coordinator of the development of the NIOSH Strategic Plan. And before we get in too deep, I do want to note that today's presentation is primarily focused on investigator-initiated grants, but it's still really good information for NIOSH scientists who work specifically for NIOSH because you'll still need to select goals for your research projects. Other extramural partners might also find this helpful just to better understand, where we're coming from with the strategic plan and how to identify goals. Kiana, it says the chat box is disabled, so people can't access the closed captioning link. I thought I did put it in there. Okay, great. Glad we got the result. Okay, so I hope everyone has the closed captions if they need them to participate in today's webinar, and then we will get started. All right. So goals in the NIOSH Strategic Plan are organized by sector and cross-sector using the same structure as NORA, or the National Occupational Research Agenda. So we have 10 sector programs, which are on the left right here, based on major areas of the US economy. And then we also have 7 cross-sectors, which are across the top here, that are kind of the major health and safety issues affecting US workers. And so we organize them into a 10x7 program grid, and that's how the strategic plan is organized. So let's talk a little bit more about the sectors, because understanding the sector and cross-sector structure is really key to figuring out where your research idea fits into the strategic plan and in that 10x7 program grid. So sectors are defined by the NAICS code, which is the North American Industry Classification System. And you can find it on these links here. Go to the GSA website, or the website where you can get more detail. And so if I don't know where something goes, I'll Google the name of the industry or the occupation and then the phrase NAICS code. And then it'll usually pop up something where I can figure out, like, okay, it's, this 5-digit NAICS code, and then I'll refer back to this table, and it'll be like 53887. And so I'll go, okay, 53 is in services. And I can click here and learn more about it. So sectors are based, and we have this chart on both the goal selection webpage and on the NORA webpage. So let's talk about each of the sectors specifically. So agriculture, forestry, and fishing is pretty much just what it sounds like. It's those 3 industries, but there are a couple of important nuances. So one is that seafood processing is included. Now, if you look at the NAICS codes, seafood processing technically falls under manufacturing, but for our purposes, we have decided to include it as part of ag, forestry, and fishing because most of seafood processing takes place aboard ships. And that's also what our stakeholders thought made more sense, was to include it as part of ag, forestry, and fishing. Other types of manufacturing are part of other types of meat and poultry processing are part of manufacturing. Construction has several different subcomponents. So, it's residential, industrial, commercial. It can be utilities, highway, street, and bridge construction. I'm sure you've seen those crews on the roads. And then also a bunch of specialty trades. So thinking about everything from electrical, plumbing, drywall, painting, all of those specialty trades that go into building some kind of commercial or residential building also count as part of construction. Healthcare and social assistance includes physical and mental health care. So lots of different kinds of healthcare here. It also includes dentistry as part of healthcare and social assistance. And then also veterinary medicine and animal care, which you might not realize are part of this sector. The social assistance part is childcare and kind of children and youth services, lots of kind of elderly services, community services. Those are a part of the social assistance piece of healthcare and social assistance. And sometimes people want to put these in services, but they are here in healthcare and social assistance. Manufacturing, there are lots and lots of different types of manufacturing that you can see listed here, lots of sub-industries. This one is usually fairly easy to identify what goes in manufacturing, though, pretty straightforward. Mining, there's 3 different types. So you have like the underground coal, which I think is our most typical image of mining, but there's also metal, non-metal, and then stone, sand, and gravel. And some mining takes place to the surface, kind of above ground. It's also part of mining and kind of the associated plants and mills. Oil and gas extraction has 3 separate industries. So there's upstream, which is like exploration, drilling, servicing the oil and gas wells. Midstream is like the pipelines that transport the gas from one location to another. And then downstream, which is like refineries and wholesalers. And we really focus here at NIOSH on the upstream industry. That's where the kind of greatest burden is of injury and illness. So that's where we put our efforts. Public safety has 5 distinct subsectors. So you have firefighters, and this is like structural firefighters, sometimes called fire service. So this is like probably what first pops into your head when you think about firefighters, where they have a fire station and a community and fire trucks and all that. But then there's also down here, wildland fire is also part of this. That's also part of public safety. And so those are kind of over usually on the West Coast, like the big wildfires. That's a very different kind of firefighting, and it has different risks involved with it and different health concerns. So then we also have law enforcement, corrections, which is like people who work in jails and prisons, and then emergency medical service. So that's public safety. Services is huge. Services is more than half of the working population, and it contains lots and lots of different types of workers. So, lots of things that we think of as like entertainment is part of services, real estate, public administration. So like government employees fall into services. Continuing on, waste management and remediation. Landscaping and tree care is kind of a smaller component, but one that we focus on a lot because it's a very dangerous occupation. And so that's a big concern for us. Building services are like kind of people that take care of buildings. So they do like general upkeep, preventive maintenance, kind of handyman kind of fixing things. And then again, lots of things that you would consider kind of entertainment or something like fun to do, like those kinds of things fall into services as well. And then finally, education is included, and that's like kind of all levels of education. So like K through 12, higher education, that's all in services. Accommodations and food services, so the hospitality industry, restaurants, bars and restaurants, like that's all in services. And then, so like repair and maintenance, so thinking of like car repair would be in services. A big one is personal care, so like hair salons, nail salons. Those have some very unique risks. So lots and lots of things going on in services. Transportation, warehousing, and utilities. Again, this one is pretty straightforward. Includes lots of different types of transportation, including air transportation. Sometimes people want to put that in services, but the airline industry and all the different jobs that go along with being in an airport are part of transportation. That's where the postal service is. Warehousing, pretty straightforward. And then utilities, one thing I want to note here is that telecommunications is in services rather than utilities. And finally, last but not least, is wholesale and retail trade. And we tend to put more focus on retail trade. And so lots of, like every kind of store you can think of falls into retail trade, ranging from like the big box stores to kind of smaller shops, all part of retail. All right, and now we're gonna play a game, and I love The Price is Right, so I'm roping you all into playing The Price is Right with me, don't worry. So we're gonna do a little bit of a game where I'm gonna give you a worker, and then you're going to figure out in a poll which of the 10 sectors you think it falls into. And if you get it wrong, it's okay. It's anonymous, and then we'll talk about what the right answer is afterwards. So our first one is this woman who works in a pharmacy. And thank you, Kiana. That's our first poll. So please go ahead and fill in the answer. All right, so most people thought it was healthcare and social assistance, some thought services, and then a few thought wholesale and retail trade. The correct answer is wholesale and retail trade. Okay, Kiana, you can go ahead and take the poll down. Thank you. Yeah, so pharmacies are generally part of wholesale and retail trade. So thinking about like a CVS or a Walgreens or one of those kinds of places, it's selling you, in this case, prescription drugs or over-the-counter drugs too. All right, this one is an emergency department. Which sector does this fall in? All right, so most people thought healthcare and social healthcare and social assistance. A few people thought public safety, and most of you are correct. It's healthcare and social assistance. So if you're in an ambulance, that's public safety, you're in like EMS service then. And then when you're transferred to the emergency department, that becomes healthcare and social assistance. So good job, everyone. Okay, so this one is animal slaughtering and processing. Which sector? Okay, so the majority of here were right. So we're close, kind of split between ag and manufacturing, a few others. So animal slaughtering and processing is part of manufacturing. Again, so the distinction is like raising animals is part of ag, forestry, and fishing. And then once they're moved to be slaughtered and processed, that's part of manufacturing. Okay, we're getting there. Okay, so this is the last one for sectors. And so this is a person painting a house. Which sector do they fall in? All right, okay, so 63% thought construction, and then the rest of the people thought services. I think these are both close, but the correct answer is construction. So that's part of those specialty trades within construction. It's house painting. Okay, so let's move on to the cross sector. So there are 7 cross sectors. This is like a quick overview of the 7 cross sectors, and we're going to go through them one by one. And these are a little trickier. So we'll take it step by step. Okay, so CRC is our shorthand for cancer, reproductive, cardiovascular, and other chronic disease prevention, which is quite a mouthful. So we usually just go for CRC, and the other chronic disease prevention really mostly refers to neurological issues and then renal disease. Not to say that that's like nothing else could possibly go in CRC, but as far as our priorities, these are really the 5 things that we focus on in CRC. Hearing loss prevention is pretty straightforward. And so one thing that I want to note here is that it includes both hazardous noise exposure and what they call ototoxic substances. So these are like chemicals that can damage your hearing. So both things are important from our perspective for hearing loss prevention. Okay. Immune, infectious, and dermal disease prevention. So this is immune disorders like asthma, contact dermatitis, allergic rhinitis, so those kinds of things. And then infectious disease is really any infectious disease. So like COVID-19 goes in this cross sector, but also influenza historically has been a big worry. Bloodborne pathogens, when you think of like sharps injuries in healthcare, that goes here, and also zoonotic diseases. So like when Zika was a big concern, that went in immune infectious and dermal. And then as far as dermal, it's a lot of like either exposure through the skin, which leads to what we call total body burden. And so this, when we get into respiratory disease in a minute, there's sometimes some overlap between the things like work-related asthma and respiratory, but we try and create a line of demarcation. So next up is musculoskeletal health. And these are soft tissue injuries, and it's like overexertion that can affect a worker's ability to perform work-related tasks. So it's like lifting, pulling, pushing. So a common one is like a back injury or like an overuse injury. So like tendonitis, for an example, could be an overuse injury. And so these are the main distinction here is between like musculoskeletal disorders and traumatic injuries. So an MSD is usually something that like happens over time. You know, either you're doing the same movement again and again and again, or like vibration can also cause MSDs. And then traumatic injury, which is a different category, is like a sudden event. So that's one way to keep those two apart. Respiratory diseases includes a lot of different things. And so we have lower, upper airways diseases, interstitial lung diseases, co-workers pneumoconiosis, also sometimes called black lung is maybe one that you've heard of here. Silicosis has become increasingly a concern for us. Then we have some cancers here, and also concerns related to emerging exposures like engineered nanomaterials or flavorings. You might have heard of like popcorn lung. That's what that's referring to. Okay, so as I was saying, there's sometimes some overlap between these things. So, you know, we have CRC, which is about cancer, but then we also have specific respiratory cancers. And then there's overlap between respiratory and immune and dermal, especially when it comes to like asthma and these more like immune effects. So in general, the way that we try and divide this up is that CRC and immune and dermal focus on like laboratory basic etiologic research to better understand mechanisms. And then respiratory is more like epi intervention studies. Now, that's not like, it's complicated. You know, it's a little bit on a case-by-case basis, which I know is a terrible answer and not really helpful. But you know, I think just keeping that in mind, and then when you look at the goals for CRC, respiratory, and IID, if you're interested in cancer or you're interested in one of these like allergen kind of issues, it's helpful to check multiple cross sectors and see which one is really the best fit. And there's an example later. We'll get into this, and hopefully that will also clarify. Okay. Traumatic injury, again, like I was saying earlier, is like sudden events. And we tend to focus on falls, and that can be from height or slips, trips, and falls that happen on the same level. Motor vehicle crashes, violence, and then like what we call struck by, which is where you get kind of caught in or struck by machinery. Those are the categories we tend to focus on in traumatic injury. And then our newest cross sector that we stood up in for this third decade of NORA and has been around since like roughly 2015 has been healthy work design and well-being. And this is really trying to take a holistic perspective and think about health optimization. And so this includes physical, emotional, mental, and economic health. And if you're familiar with total worker health, that falls into healthy work design and well-being. It's also things like that are more economic considerations, like how work like non-standard work arrangements. So whether you're a temporary or a contract versus a permanent employee, thinking about policies around like sick leave, paid sick leave is a big one, having access to benefits, like those kind of economic issues fall into healthy work design and well-being. And then also thinking about stress and work organization. So like the policies that are put in place in workplaces, kind of how work is structured and how that impacts safety and health. So something around like safety culture, safety climate, that would go in healthy work design and well-being. Okay, so we are going back to The Price is Right. And this time we're gonna spin the wheel, but it's not gonna be any different. We're still gonna do polls. But just in your head, shoot for the dollar. You want the dollar. Okay, so same deal. We're gonna put up a scenario, and then you're gonna try and figure out which cross sector it might fall into. Okay, so this is heat stress. Where would heat stress go? Okay, lots of different answers, which I think is fair because this one is definitely tricky. So I say the most popular answer is traumatic injury, and I could see why you might think that because you're experiencing heat stress, you might be getting like sweaty palms or fog glasses, and that might cause you to have an injury. Like I've heard that argument made before, but our answer is it depends. And it is either CRC or healthy work design and well-being for two reasons. So in CRC, like I said, that one is mostly like basic etiologic laboratory. So that one is where you'll find heat stress goals related to just kind of understanding the physiological effects of heat stress on the body is in CRC. And then healthy work design is about interventions that are mostly around work organization. So it's things like acclimation schedules, rest breaks, the availability of shade, like kind of how work is set up in these outdoor environments where heat stress is a concern and how we can better organize work to reduce risk. So that's why. So if you're interested in heat stress, definitely an important topic. It's in a couple of places. Okay, so hopefully this one is a little easier. This is a person driving a vehicle who might experience whole body vibration. Yes, great job, everyone. Okay, yes, 85% of you, 84, excuse me, thought musculoskeletal health. That is absolutely correct. Yeah. Okay, this one again, really hard, but we're gonna talk through it. Okay, so this is opioids and substance, more broadly, really, the term that I should be using is substance use or misuse, which includes opioid use or misuse. So this one is, again, pretty tricky. So it depends. And this one took us a long time to really think through where this might go because it's a really complicated, multifaceted issue. And so we know that opioid misuse has been linked to work-related injuries. So like a musculoskeletal injury or a traumatic injury. So, you get hurt at work, either, a repetitive motion or repetitive injury like an MSD or, some kind of like fall or something like that. So then you start taking these drugs and then you might become dependent over time. So that's what we were thinking there is that, that's an important connection that we need to worry about. But also there are work organizational and psychosocial aspects of the opioid crisis. And that's where healthy work design and well-being comes in. So thinking about ways to provide supportive policies and practices to help workers who are dealing with substance use issues, how can we best support them? So you might have seen NIOSH's work about like a workplace supportive recovery, that kind of thing. Okay, then on top of that, we also are worried about first responders who experience violence on the job related to opioid use and misuse. So sometimes, for example, people who are revived using naloxone can become violent once they regain consciousness. And so then that puts the first responders at risk. So that's another, workplace violence goes in traumatic injury. And so that's another reason why traumatic injury is included. Okay, so I hope that made sense, because this is a big, important issue, and I know lots of researchers are interested in contributing. Okay, so now we're going to, now that we have a better understanding of the sector and cross-sector framework, we're going to talk about how to actually select goals from within the NIOSH Strategic Plan. So we have the 3 levels of goals: strategic, intermediate, and activity goals. So strategic goals are like the really big picture, like what are we trying to change in the world? And it's generally, we want to reduce an illness, an injury, a fatality. We want to optimize health, right? So what is our big thing that we're trying to do? And those are the 7 cross-sector issues, basically. And so we have a strategic goal for each of the 7 cross-sectors. It's a very clear 1-to-1 ratio. So once you figure out your cross-sector, or it might be more than one cross-sector, that's totally possible too. That will help. That tells you what your intermediate goal, or that tells you what your strategic goal, or goals plural, would be. So that part's easy. So then intermediate goals are really focused on what things we hope that other people will do with our research. So, we produce this important data, and then we turn it into, tools and trainings and infographics and all kinds of stuff. And we want people to use that information. So that's really what we're going for in these intermediate goals. And so these are shared by sectors and cross sectors. And so, like, we go to the next slide. So this is going back to the 10x7 grid that we talked about earlier. And the intermediate goals, if you go to the website, we have this table, and they are shared between these 2. So if you're worried about respiratory health and construction, you would go to the table, look at the intersection, and see what we have prioritized here. And so if you click on each one of these links, it takes you to a page like this, and there's these little drop downs that you click, and it shows you a table like this. And so this right here at the top is this language right here at the top is the intermediate goal itself. So it's talking about who we want to take action and to what end. So we're trying to reduce mixed exposures among construction workers. And then there's a table that outlines the different research that we think is needed to make this intermediate goal a reality. And so these are standard tables that you'll find for every goal. And so the health outcome column is usually a more specific version of the cross-sector, or which is also the strategic goal. So, it's usually just a little bit more specific. So like there's a lot of different things that fall into respiratory health, for example. And so this would get a little bit more granular about which respiratory issue that you're focusing on. The research focus is the problem to be solved. The worker population is the group with the highest burden or need, and it could be a subsector. For example, it could be like within public safety. I might say firefighters. This is an issue for firefighters. Or it could be a more cross-cutting group. So it could be workers in small businesses, or contingent workers, things like that. And then finally, the research need is like, which of the 4 kinds of research? Like, are we looking for a lab study? Are we looking for an intervention? Do we need to do some surveillance research, or translation, which is like thinking about these are the on the website, we have this section that has definitions for each of the different boxes in the intermediate goals table. But I really wanted to draw your attention to the different research types, because these are terms that NIOSH has specific definitions for that you might not be familiar with. So I think this is a helpful way to see what the different types of research are. Okay. All right. And then each intermediate goal also has a narrative. So it talks about the burden and need using our burden, need, and impact BNI framework, which you might already be familiar with. But basically the idea is that the burden is describing like what data do we have, whether it's hard data or feedback from stakeholders. That's something like sometimes we don't have hard data, but we're like hearing anecdotally that this is something that might be a big problem and we should look into it, like an emerging issue. So what data do we have to show that this is a concern? And then the need gets into like what specific kinds of research would be helpful, what thing, like it just gives a little bit more information about what we were thinking about when putting those tables together, which you might also find helpful. Okay. And then activity goals are the category of research needed. So we just went over the basic etiologic intervention, translation, and surveillance. So they're fairly boilerplate goals, and they don't say exactly what research is needed. It's just kind of like just the category. And so the idea here is that using that general category and that researchers would use their creativity and their expertise to design studies in that area. So just, if you know what kind of category you're in, that tells you what the activity goal is. So the really, I think, challenging part is figuring out your intermediate goal. And then from there, it should be pretty straightforward to figure out which activity goal is based on the type of research. So here's an example for a goal. And you'll notice that it only has two kinds of research, basic etiologic and intervention. And that's because that's all we thought was necessary. Like sometimes we're just not there yet to get to the later stages. And so that's really what's going on here, is that we need to focus on like the more earlier type ones. We're not at translation yet, so we don't have a translation goal. We didn't feel like surveillance research was needed, so we don't have a surveillance research activity goal for this particular one. Okay, so you might be wondering, what happens if your idea doesn't match any of our existing goals? And I would say, please consider how you might adjust your concept. So we really spent a long time carefully considering our priorities. We very carefully used BNI, the Burden, Need, and Impact framework. We had discussions amongst multiple programs that have expertise. We used input from our NORA agendas that the NORA councils wrote. So we got a lot of stakeholder feedback through there. So we really carefully considered this and thought about what would give us the maximum benefit for our investments. And that's not to say that there are not other worthy things to research. There's an infinite, endless list of things that are worthy of researching. There are no ends of health and safety challenges for workers, unfortunately. But the kind of harsh reality is that we have limited resources. And we have expectations that we are going to be accountable for those resources and show impact. And so because we have limited resources, we have to think about what our best investments is. And that's what the strategic plan is. It's really outlining what we think our best investments are. So I would suggest that if your idea doesn't match a goal, like take a minute and think about how you might be able to adjust your concept to better fit what we already have in the strategic plan. Okay, so now we're gonna put it all together and do a couple of case studies, and then we'll get to questions. I see the Q&A number going up, and we'll get to those once we put it all together. Okay, so now it is time for the Showcase Showdown. Get excited, it's happening. Okay. Our first showcase, home care workers. So you are interested in home healthcare workers. You know that they have a lot of potential risks at their job. You're thinking about slips, trips, and falls. You're thinking about strain injuries. So maybe like trying to lift a patient and you could hurt yourself if you don't have like the appropriate equipment or assistance to do that. So you're worried about strain injuries. You're worried about bloodborne infections. You're worried about respiratory hazards from cleaning and disinfection, like those kind of harsh chemicals that you can have allergic sensitization to, that kind of thing. So you're like, okay, I know this is a great idea. These workers can really use some help and my research can do it. Great. Okay, strong concept. So first we want to identify the sector and cross-sector. So this one, the sector, pretty straightforward, right? We know it's a home healthcare worker. They're going to be in healthcare and social assistance. Then we start thinking about cross sectors. And so just going through kind of one by one what the different ideas were. So slips, trips, and falls, that's going to be in traumatic injury. A strain injury is going to be musculoskeletal health. Bloodborne pathogen, that's going to be immune, infectious, and dermal. And then finally, the respiratory hazards from cleaning and disinfection, because this is more of an intervention thing and not a mechanistic study, that's going to be respiratory health. Okay, so now that we've identified our sector and cross sector, then we're going to go to the big table on the strategic plan website and start looking at the kind of intersection between healthcare and social assistance and these various cross sectors, and they just all happen to be in a row here. So then you would, click on each one and start investigating and seeing, where have home healthcare workers been highlighted. Okay, so so the first one was slips, trips, and falls. So we see, we go to traumatic injury and we see that it's injuries, but especially violence prevention. And we see a couple of places where home healthcare workers are specifically called out in terms of just injury risk factors more broadly, and then also violence prevention. And so I would say, if you hadn't already been considering violence prevention, maybe you should think about it. Maybe that should be part of your intervention, because it's a really important issue. These workers are going into people's homes where emotions are often running high. People are very sick. They need a lot of help. Maybe that's something to consider. Okay. The next one, we said strains. Okay, so we have a goal on safe patient handling. That seems to be a fit. And then we have here for vulnerable workers is the worker population. And thinking about home healthcare workers, they can definitely be considered a vulnerable population. So it's often women, it's often low paid work, not given a whole lot of respect. Some people are like self-employed, and that puts them in a little bit more of a precarious position than if they're working for a larger company. So, okay, this seems like this is a good fit here. We're worried about bloodborne pathogens. So like, okay, sharp safety. That's part of this goal right here, 3.3. Okay. And then looking at respiratory health, we definitely see there are cleaning and disinfection agents as part of work-related asthma. All right. So it seems like this is a pretty good fit for what we have in the strategic plan. But I would also say, click around and also consider other places that you might not have already thought of. So one thing that you might not have considered is work organization as part of something that could help home healthcare workers. And so, looking here, you see that, that's called out for fatigue and stress, especially for home healthcare workers that are kind of driving between different homes. If they're very fatigued, that might be a risk for motor vehicle crashes. And then kind of as I was alluding to earlier, it can be like a very stressful environment where you have these difficult interpersonal interactions. And so again, maybe that like workplace violence, this kind of stressful situation that might be contributed to mental health issues, like maybe that's something that you want to consider making part of your project. Or do that in lieu of your original idea. Just, something to think about, because the idea here is that you use the strategic plan as the starting point and kind of mold your ideas to fit it, rather than having like a very defined idea and then trying to like, squeeze your way in somewhere is the ideal scenario here. One word of caution though, more is not always better. So it's not necessarily better to use as many goals as possible. It's great, totally fine to choose one goal and do it really well. Like that's also great. Sometimes it makes sense to do these more comprehensive approaches that hit multiple health issues at the same time. Or sometimes you just need to really narrowly focus on one thing. So it's, please don't think that you need to pick 5 goals to up your chances, because that's not at all how the system is set up. Okay. And then now we're going to go on to our second showcase. So this one is asthma caused by isocyanates. And these are in like spray foams, and also in like when they spray on the linings on truck beds, those also have isocyanates. And you want to do a lab study, kind of understanding the underlying mechanism between exposure to isocyanates and asthma. Okay, so again, we're going to start with sector and cross sector. And in this case, the cross sector is a lot more straightforward. We're doing a lab study. It's about work-related asthma. Immune infectious dermal is the place to be. But which sector? So then you ask yourself, like, where is this a big issue? Who is exposed to isocyanates? And so we know that's most likely construction or manufacturing. All right, so we go to our big table and we see, looking at the IID column, what do we have for construction and manufacturing? And you'll see that there's not anything for construction, and that's because we haven't prioritized that. So that one is kind of a non-starter. But looking down at manufacturing, we do see that there's exposures and immune diseases. That sounds promising, right? So we click that one and we see this is exactly what we're looking for. Mechanistic studies, slam dunk. This is it. This is our goal. So everyone is a winner, even if you weren't thinking my way to begin with. And so I hope this has been a helpful explanation. So this is the end of the formal presentation, and now we will get to Q&A. And I should also say that we have here with us from the NIOSH Office of Extramural Programs, we have we have Alan Robeson and Danjanea Williams here, who will be helping me to answer questions, especially if you have questions about like very specific like technical questions about how scoring and funding is awarded. They're gonna help with those. Okay, so I have not been looking at the Q&A. So Danjanea and Alan, if there are any that you want to take right off the bat, and I will start looking at these questions.
Okay, well, we have one, Emily. Where would farmer and farm worker mental health fit?
Yeah, so farm workers are definitely going to be ag, forestry, and fishing. And then mental health is generally in healthy work design and well-being.
Here's another question for you. Are public safety dispatchers, such as 911 operators, considered public safety or services?
So usually we lump them in with public safety because they're considered like the first responders.
There is another person. This is more of a comment. Someone wanted you to go back and show the matrix of sectors and roles that they play. I don't know if we have time right now for that, but someone was just wondering if you could go back and explain the matrix with the sectors and cross sectors again.
Let me see if I can find the slide that has the 10x7 grid. And if this was a lot to take in, I totally get it. And we have a website, a webpage that kind of walks you through everything that we just went over. That is up and you can check out anytime you want a refresher. Because I know it's hard to remember too, like you hear this, but then you don't go to write a proposal for 6 months and it's not as clear anymore. So that webpage is definitely available. So these are the seven cross sectors across the top and the 10 industry sectors across the side. And the idea is that each cell is a place where the two interact. So, just looking at this top corner, ag, forestry, and fishing, and CRC, one thing that's in that cell is like renal diseases because of pesticide exposure. So that's the kind of thing that would go in that cell. So that's the idea, is like really drilling into specific health issues that occur in specific worker populations using a grid. I hope that answered the question.
I think it does. I think the person just wanted to go back and for you to explain it just like you did. Next question for you. Isn't wildland firefighting and ag, forestry, and fishing per the NAICS codes?
Yeah, so in some cases we have chosen to not go with the NAICS codes, and we have chosen to put wildland fire as part of public safety. Yeah, there's a couple of other places where we have chosen to go our own way a little bit, and those are noted in the NAICS codes table. Let me go back to that. So you'll see here, it'll say like mining, except oil and gas extraction. So like if you look at the NAICS codes, like oil and gas would just be part of mining, but we've chosen to make it its own sector. So.
Okay. One more question. Is there a way to search intermediate goals by more specific job category? The example given is commercial fishing.
So there is a word, or excuse me, it's a PDF. And so you can do like a search function within the PDF if you wanted. So you could do like commercial fishing and go through all of the hits that way. We definitely do have commercial fishing as part of the strategic plan. That is one of our priority groups, and ag, forestry, and fishing.
Okay. Here's another question. Is the fit with goals, intermediate outcomes, and activities a part of what consideration is what's considered during study section review, council review, or both? So this is, more of a grant related question.
Yeah. Alan, could you please take that one?
Sure. Thanks, Emily. My response would be that it's a little bit of both, because it's not only selecting or identifying a goal, it's also describing and classifying the burden, need, and impact in the application. And so and then under the peer review criteria, under significance, reviewers are asked to assess how well the application addresses burden, need, and impact. And so it's a combination of burden, need, and impact along with goal identification, and it's both a peer review consideration and a council review consideration. Thanks.
Okay. Next question. Are Small Business Innovation Research Grantees, or SBIR, from the National Institute of Health eligible for complimentary NIOSH grant support to investigate the need for innovative device that NIH would like to see to come to market? So the question is, I think kind of, do these goals apply to SBIR grants is really?
Yeah, that's a good question. And I would say, in general, yes. And, but probably there's more latitude with SBIR grants than there are with investigator initiated grants. And certainly for the applications that do address burden, need, and impact, and also do well with their scientific peer review, it gives those applications a little bit of an edge when it comes to funding consideration.
Okay. A few more questions left. Where does the future work program fit in with the NIOSH strategic goals?
Yeah, so it's already incorporated in a few places. So we have some goals specifically looking at like robotics, nanomaterials, those kinds of things. And then as we have a better understanding of where we're going with the future work initiative, so the plan is to, when this iteration ends and we start working on the next iteration of the strategic plan, that the future work is kind of a lens that we'll be using, because we want to be really forward thinking. in our strategic planning, knowing that the world is changing around us and we want to try and anticipate the changes that are coming. So that's going to be a lens that we'll use because the future work could really touch any goal in the strategic plan. It could fit any cell in the 10 by 7 grid. So it's something that we are definitely interested in further incorporating as we go on. The future work was kind of launched after we were underway with the strategic plan, but we want to do even more of that thinking going into the next version.
Here's one other question. Considering the matrix, someone noted there is a blank cell in a healthy work design and well-being column for agricultural, forestry, and fishing. Does this mean that NIOSH is discouraging work in this cross-sector in favor of other work?
Yeah, so if a cell is blank, that generally means that we have not prioritized that. So in this very particular case, I have been talking with like Jennifer Lincoln and Casey Elliott about what a concern mental health is in ag, forestry, and fishing, and whether as we move into the next iteration, which is going to be here before we know it, we should really reconsider whether that particular cell should be blank. But again, it's hard because we can't do everything. But that one in very specifically, we've been talking about whether we need to revisit that.
Okay. Next question is looking at focused on CRC, and it says, would biomarker studies looking for genotoxicity endpoints be considered cancer / kind of chronic disease prevention?
Probably. I'm not terribly familiar with genotoxicity endpoints. It sounds like a CRC candidate, especially if it's more of a laboratory-based kind of a thing. I'm still learning about, I've been at NIOSH since 2014, and I'm still learning every day about all the different health and safety issues that affect workers.
Okay, that concludes the questions. I don't know, Emily, do you have any closing remarks?
No, I just want to thank everyone a lot for making time in their busy day to come attend this webinar. I thought they were great questions, and thank you for coming. I just really appreciate it.